So what you're gonna want to do is have your patient have his foot straight up, his or her foot straight up, so that all the bones are in line, and you're gonna just tap the top of all the phalanges or wherever she says it hurts. And positive test would be shooting pain, and the implications of that would be a phalangeal or metatarsal fracture. Now for a long bone compression test, again, you would have your patient have their foot straight up so that all the bones are in line.
Hey Louis, hang on a second. Any questions on this tap test? And just so you guys know, feel free to ask questions, alright? Because they're supposed to be the experts on this right now. Alright?
Great.
And do me a favor and do a separate video for each one.
This is the long bone compression test. Have your patient dorsiflex their foot and have all bones in line. And you just grab the top of each phalange and just push down. And go down the whole foot. And if there's a positive test, would be shooting pain in the foot, and the implications would be phalangeal or metatarsal fractures. Intermetatarsal glide test. So you just grab the metatarsals. Right now I'll start with the first and second, and I'll work my way down laterally down the foot. You just grab them and you just push them up and down. You go along the whole foot. And a positive test would be pain or increase or decrease gliding. And the implications of that would be a sprain or intermetatarsal neuroma. I almost forgot. Thank you, Kirsten. All right. All right, so you're gonna grab, I'll start immediately. So I'll grab the first metatarsal, and you're gonna want to grab the tarsal that lies behind it. You can grab each one and just pull and push them up and down, back to side, and you'll feel for gliding. Just go along the whole foot. A positive test would be pain or increase or decrease gliding, and if there's pain, the implication would be that there's a sprain to one of the ligaments, and if there's a decrease, no wait, I messed that up. No, all right, yeah. And if there's decreased gliding, the implication can be that there is a joint adhesion with their feet under their shoulders. So, yep, you got a little wider just for the video. Thank you. What you do is first you're gonna palpate the medial malleolus, and you're gonna draw a dot on it with the marker. This marker doesn't work. And then you're gonna locate the MTP joint of the first metatarsal, and you're gonna draw a dot on the plantar surface of it. Here. And then you're gonna locate the navicular tuberosity. And then you're gonna draw a straight line from the MTP joint to the medial malleolus. Oops. Not an artist. There it is. And so there's no positive or negative test, but you just look at the dot of the navicular process and use that to see if the patient has pes planus or pes cavus. And if she has pes planus, she's hypermobile, and if she has pes cavus, you know that her foot's capable of absorbing lots of shock. Right.
Thank you.
With the navicular drop test, what you do is you file a navicular, put a dot on it, and you take a paper or a note card or something. Actually, you have them sit down in non-weight bearing.
It would have been good to have a video.
And you measure from the ground.
You guys can move around if you want.
And then you have them go weight bearing. You measure it again. And then you look at the difference in the two lines, and if it's a positive test would be if it's more than 10 millimeters, and that would mean that they're either pes cavus or pes planus, and they could possibly use orthotics. And lamps. With the subtalar neutral, you reach under and you find the talus on both sides, and then you align the foot to where there's pressure, the same amount of pressure on both fingers. And then a positive test would be if you need to align it, and they could use orthotics. You're going to have them sit at the edge of the table. You're going to observe their arch, and then you're going to have them go weight bearing, and observe the arch again, and then have them go up on one foot, and observe the arch again. And if a positive test would be if the arch, when they go weight bearing, it disappears and then reappears when they go non-weight bearing again. And then an implication of that would be if it reappears, then they are they have a fallen arch of the pes planus. And then also if they have pain when they're going up on the foot, they could have plantar fasciitis. So the dorsiflexion eversion test, you're gonna put their foot into dorsiflexion and evert it. You hold it for 5 to 10 seconds. And a positive test would be if they have pain in the posterior aspect of their leg, and that would implicate a posterior tibial nerve dysfunction. There's Tinel's sign, which you tap behind the medial malleolus, and a positive test for that would be shooting pain again, and that would also implicate a tibial nerve dysfunction.
For the Mulder test, you're just going to hold your foot like this. I'm going to put one hand or one finger on the first metatarsal and one on the fifth, and I'm just going to squeeze the foot together. A positive test for this would be clicking or pain or reproduction of any symptoms he's had before. And then the implication would be that he has an intermetatarsal fracture or metatarsal geo. It is kind of similar. You're just going to take it and you're going to push the pencil in between each of the metatarsals.
Yeah.
In between each of the metatarsals. Again, it's just going to be pain or reproduction of symptoms, and it's going to be an intermetatarsal fracture or metatarsal geo. So I'm going to find his first tarsal, and then I'm going to hold on either side, and then I'm going to find the adjacent tarsal, and I'm just going to try to glide them. I'm just going along, finding each one and gliding them. A positive test is either pain when I do it, or too much or too little glide. And then the implication for that would be if he has too much glide, it's going to be a ligament sprain. And if there's not a lot of glide at all, it could be a joint adhesion. You're pushing towards the lateral side and you're stressing that MCL, or it could be an avulsion fracture. And then for varus, you're going to push in then to the medial side, and it's testing the LCL, and it could be an avulsion fracture as well.